So for us to be away from the practice, for 3 doctors to be away from the practice for 3 days, that's a lot of investment. But all our children are worth it.
That lecture absolutely changed my life. When I heard what I could do, what I heard I could provide for my patients, I was sold. Not only did I find my niche, but I found my passion. I found out this is what I want to do. This is going to be my world, and I'm going to save it.
So we were looking for this class actually for a while, okay? So we were looking for that. We were expecting that.
Probably about 15 years ago when I listened to Dr. Bergeson. And I've always thought there was a big place for it in trying to straighten teeth without braces, but you had to be very selective. So, and I knew at that time we kept saying to him, you have to develop a class so people can come. And just now finding out that now he's even done a whole lot more research and has put it together into being HealthyStart.
Of course we know about sleep apnea, of course we know about ADHD, drowsiness and everything, but now putting everything together and it's just like everything becomes so clear. I have a direction to go forward to treat this patient.
One thing that I initially knew about it was just the way that we could treat space issues with teeth. I did not know the other issues that it could treat as far as the sleep deprivation, different things like that. So it's good to know that we have an additional option and we don't have to refer these patients away. We can actually see them in our office.
So it's unbelievable. So it's like open your eyes and you can see like why they're, you know, it's like you can see, you have better idea. So how it's working, how everything connected. So now when Gil was talking, I start thinking about my patients and see, oh my goodness, this kid has ADHD and it's connected. He's having mouth breathing also and he's having some issues. So like you are connecting everything, you know, because in the relationship with the breathing and all these things. So now like we are more aware to trying to detect more signs, you know, not just, okay, you are crooked teeth, so we're gonna go straight to that. So now we have to see how they are breathing, how their face they look, how they are talking, how they swallow, you know, more stuff we have to see.
Okay, so this is beyond the books.
Yeah.
This is training your eye and giving you techniques.
I definitely would recommend this class to anyone that's thinking or not thinking about it, because not only was it super educational, but it's very applicable to any and everyone out there, whether it's to yourself or to anyone that you know of. The instructor was very awesome as well, because not only was she super educational, her motivation and her attitude in just knowing about wanting to take care of the health of people really motivated me personally to not, you know, even as minor as fall asleep in the session. I was always fully engaged.
Well, we can give the doctors a heads up, especially when we look on their midlines, their bite, and also if they have habits like mouth breathing, and also darkness on the eyes that can, you know, indicate that there is need for those appliances.
Before this class, did you know to look for those things?
No, not all of those.
We get trained on the conditions, so we know, different ways to treat these conditions, but as far as the actual appliance itself, I was not introduced to it at all in dental school. So it's definitely something that needs to be introduced to the curriculum. If not at the dental school level, definitely at the residency level, because we're going to be seeing these patients every day in pediatrics.
All the information that we have got, even down to the materials that we got, so very organized in that, so we can still look back on those things. We just covered so many things. I just can't talk enough for Dr. Jill keeping the all the information, everything, making it a fun class as well as learning in that. All, she was repetition. She would always go over things over and over again, which really helps you stick in your mind in that, which is really nice, because a lot of times when you go some other classes, you don't always get that.
I think it's very informative, and I think it's going to help a lot of families, especially when it comes to their sleep. And there's a lot of studies out there that relates sleeping and also the habits that can affect their life.
Definitely the whole relapse is a huge thing for me, because even with my friends, the one big complaint is they don't want to have an appliance throughout the rest of their life. And with the possibility of not having to need that is a huge big plus for me. And also not just with teeth, but it deals with so many other health benefits with, and not even just health benefits too, with educational too, behavioral. There's moms that always mention that they've lost their kid and it has them back. So it's just totally life-changing. Yeah.
It's actually very popular outside of the United States. It's popular in countries where prevention, well, they don't have a lot of money. Let me not say prevention is not as important to us. In the United States, we're more into treating. We have the facilities to treat. So we really, however bad it gets, we have something to try to make it be better.
Because sometimes we are just focused on teeth, and now you can see how they breathe, how have connection with the eyes, with development in the school. So it's unbelievable. And the other thing is that I like it is, like we are, with this appliance, maybe we're gonna be able to guide the kids since they are very little to the healthy adulthood.
So no, I didn't pick and choose. Actually, the people who didn't come are quite upset. But we will arrange for them to learn what we learned. So we picked on who would be able to educate more of the people who are here who didn't get to go to the class. So ideally, close your office, take everybody.